All right, back with Dr. Jon Liprie. We're talking, Prostate Cancer Awareness Month, which was September, but as we've already established, that's a January to December kind of deal.
Oh, absolutely.
John, risk factors.
Yeah, so risk factors. The biggest risk factor is age.
Oh.
Yeah, men of a certain age.
And I've got a couple on you.
You do.
So, all right,
as we get older, obviously it gets higher.
Right,
yes.
right. And then is there, does your race affect it?
Yeah, great question. So black males are twice as likely as white males to have prostate cancer. Also, family history, a big deal. This is one of the few where I really have to pay attention. Family history of prostate cancer, especially before 55. Family history of breast, ovarian, or pancreatic. They're all kind of related.
So those last two questions, when you fill out that document in the doctor's office and say, is there a family history of this?
Yes.
This is a potential concern.
Correct. And I'll be honest, about half of the time it's not relevant.
Right.
But this is one where
every once in a while it is.
Yeah.
All right. Tell me some good news. I'm a glass half full guy, John.
So the good news is the overall rate is dropping. That when you look at the rate of incidence of cancer, we're detecting it better, but the rate is still dropping.
Is the rate dropping because we're being a little smarter, we're being a little more proactive about this stuff?
I'm going to be an optimist and say yes, but we really don't know likely. Right?
Glass half full, part two.
Oh, that's we're a team.
All right, treatment making a 5-year survival.
It's really good. It's
really?
Almost 100%, regardless of whether it's contained within the prostate or just about on the outside, what we call regional. When it's spread throughout the body, that number does drop about 36%, 5-year survival.
So again, preemptive strikes in fighting it back.
Definitely.
All right, John, individual states, where is Louisiana in terms of prostate cancer?
We're number 3. Yeah.
Well, at least we're not number 1.
Mississippi is actually better than us at number 7, and for some reason Connecticut, number 1. Now there isn't any correlation to any factors here. It's just that not all states are created equal.
Yeah. Okay, all right, so final thoughts. Folks of a certain age group, as you've so eloquently said.
If you're over 55,
what do we need to do? And
we're both spec over.
Okay.
Over 55, you really need to start getting screened, and that's yearly. That's a blood test mostly. Sometimes it'll have to be an exam.
Yeah, and it seems to be part of my annual, so.
Yeah, it really is.
Awesome.
All right, thank you.
Dr. Jon Liprie, always. John, we have a Storm Track 15 meteorologist. Would you care to send things over to him?
I'd love to send it to Storm Track 15 meteorologist Adam Olivier.
Well, we're keeping a watch on radar this morning as some showers move their way through in northern Louisiana. I'll give you the latest on that coming up.